Energy for the normal functioning of your body comes from the food we eat. Carbohydrates are a major component of food that provides energy. Proteins are required to build our body. During and immediately after a meal, the process of digestion breaks carbohydrates down into sugar molecules, of which glucose is one, and proteins into amino acids. Right after the meal, glucose and amino acids are absorbed directly into the bloodstream, and blood glucose levels rise sharply. Insulin is a chemical that is secreted from the pancreas, which is a gland that lies behind your stomach in your tummy. The rise in blood glucose levels signals important cells in the pancreas called beta cells to secrete insulin, which pours into the bloodstream. Within 10 minutes after a meal, insulin rises to its peak level. Insulin then enables glucose and amino acids to enter cells in the body, particularly muscle and liver cells. Here, insulin and other hormones direct whether these nutrients will be burned for energy or stored for future use. It should be noted that the brain and nervous system require glucose round the clock. They cannot use any other substance for their needs. As blood glucose levels reach their lower peak, the pancreas reduces the production of insulin. About 2 to 4 hours after a meal, both blood glucose and insulin are at low levels. The blood glucose levels are then referred to as fasting blood glucose concentrations. When your body does not have enough insulin, sugar cannot get into your cells. As a result, you have high levels of sugar in your blood. This is called diabetes. When you have too much sugar in your blood, many problems may begin to occur. These problems can be life-threatening if they are not treated. However, proper treatment can control your blood sugar level. Let's take a look at the typical symptoms of diabetes. Increased urination, since excess amount excreted in urine glucose draws more water. Excessive thirst and the drinking of a lot of fluids. Increased appetite. Weight gain or weight loss. Blurred vision. Skin infections. Tiredness. Slowly healing sores. An abnormal prickly feeling, burning or itching of the skin, usually on the hands or feet. On testing the level of sugar in your blood, if your morning fasting blood sugar, that is before breakfast, is above 126 milligrams per deciliter, you may be diabetic. Since the glucose levels are high in blood, and when they cross a particular level, they are then excreted even in the urine. At such times, one can detect the presence of high amount of sugar in the urine also. This test is also commonly used to monitor diabetes. When you have too much sugar in your blood, many problems may begin to occur. These problems can be life-threatening if they are not treated. Diabetes commonly affects 3 body structures: the nerves, eyes, and kidneys. Nerves are like fine wires that carry messages to and from your brain. They are required to feel various sensations of hot and cold, smooth and rough, etc. Nerve damage, also called diabetic neuropathy, most often affects the feet and legs, but it can also affect other parts of the body. Nerve damage makes it hard for your nerves to send messages to the brain and other parts of the body. It can mean you lose feeling in parts of your body or have a painful tingling feeling. If you have nerve damage, you may not be able to feel an injury like an ulcer on your foot. The ulcer can then become infected and in serious cases, the foot may have to be amputated to prevent the infection from spreading all over your body. The retina is part of the eye that is sensitive to light and helps you see. Diabetes can damage and weaken the small blood vessels in the retina. This damage is called diabetic retinopathy. When the blood vessels are weak, they can leak fluid, which causes swelling in the eye. The swelling blurs your vision. If the retinopathy gets worse, your eye makes new blood vessels over the retina. But these blood vessels are fragile and break open easily, which causes bleeding into the eye. Scar tissues that follow bleeding may make the retina break away from the back of the eye and lead to blindness. Laser surgery can often be used to treat or slow down retinopathy, especially if it is found early. Kidneys are important excretory organs that are situated in the back side of your abdomen, close to your spine on either side. Diabetes can also damage the blood vessels in the kidney, called diabetic nephropathy, so it can't filter out the body's waste. This can lead to accumulation of toxic substance which comes in the way of normal functioning of the body. Many a times, high blood pressure is commonly associated with nephropathy. This can further damage the kidney. If the kidneys are damaged, they lose their efficiency and this leads to filtering out of proteins from the blood into the urine, which are otherwise not excreted. Protein in the urine is usually the first sign of nephropathy. Excretion of proteins can further aggravate nephropathy. If your doctor notices early signs of this, he or she can put you on a medicine that helps protect the kidney from damage. If you have diabetes and high blood pressure, it is important to keep them both under control as much as possible. Some people who have nephropathy need dialysis or kidney transplants.